Hello. So today we are going to talk about the very basic idea of how to study Materia Medica. It's a very first stage. It's a kind of our need to develop a wisdom that how we need to study our Materia Medica in the life. Because most of the time, throughout our homeopathic lifetime, in our practice, uh, we are in the process of learning, we are in the process of studying the Materia Medica. But in all these processes, most of the time, we try and rush behind the materials, behind the books from which we can gather the knowledge, we can increase our knowledge, and we can increase our knowledge of Materia Medica. This is good, this is mandatory as well. But at the same time, this is not enough. This is very, very important to understand. I would like to give a direct quote given by Dr. Phatak in his Phatak's Materia Medica. In the very initial para, he has written the hints for beginners, the whole chapter named as hints for beginners. And in the second paragraph of that hints for beginners, he has written that the drugs should become your friends. You can identify your friend from the way he rings the bell, he opens the door, climbs the footsteps, etc. Similarly, you should be able to know the drug. It's all about creating a kind of complete familiarity with each substance. That's why whenever we are studying in a very initial time, whenever we are studying the sources of homeopathic drugs and the Materia Medica, we study the sources like proving on healthy human beings, proving on healthy animals, proving on healthy plants, and then we don't stop there. We continue from there, and then the next important part is the empirical sources. Like the way each substance is being used even in the other branches of medicine, the way each medicinal substance is. Just now, recently there was a case of dysentery with which we were struggling, and there was a wonderful idea given by one of my friends who is practicing Ayurveda, and he told that you can give billo. Billo is bilipatra, what is very commonly used in Ayurveda, and in homeopathy we have a complete proving of agelfolia, which is prepared from the same medicine, and which we also use in the cases of IBS and in the cases of the dysentery. So each substance, so there are possibilities that agelfolia is not being given in Allen's keynote. There are possibilities that agelfolia is not given in the Kent's Materia Medica, but that doesn't mean that we can't use it whenever the case indicates that particular substance. But for that, we need the holistic understanding of each medicine, what we have. And this is a very fundamental need in my whenever I teach, wherever I teach. The commonmost question which I face from the students is the same, that sir, which book should I read to get the knowledge of Materia Medica? But the point is that ideally it should be much more than some number of books. Ideally it should be directly the source books, and along with that also the rest of the information available in the whole universe about our medicines. See, just you need to understand what is a medicine. While I was just preparing something to communicate with you, then there are few things which I received to give you the clarity about the subject, that what is the medicine. So Materia Medica of each medicine is the dynamic, qualitative experience of a particular drug substance entered in a prover as an experience, and which is being narrated through the subjective and objective symptoms. So the point here is that each medicine is a dynamic, qualitative experience. So each medicine is also matter plus energy. As we, as a human being, we are also the physical being, the quantitative aspect of us, and the vital force, the qualitative aspect of us. Similarly, our own arsenicum album is not only the toxicological property of arsenic, it's an energy of arsenic. And at the same time, it is toxicological as well. Our hyoscyamus is not only an energy of hyoscyamus, it is also the very basic qualitative alkaloids of the hyoscyamus. That is hyoscyamine. So the point is that it's a blend of these two. So to understand any medicine, to understand the whole blend, we need to look at every medicine from 360-degree view. Then and only then they can become our friends. So I'll again repeat the sources like proving on healthy human beings, animals, plants, where in the animals we can get more pathological features of clarity of the pathological role of the medicine. Then in the plants, then the empirical sources, then toxicological sources. As we know, the lot of symptoms in lachesis, there are a lot of symptoms in elaps, lot of symptoms in stramonium or hyoscyamus or belladonna, symptoms in conium mac, the symptoms in the strophanthus hispidinus. In all these medicines, what we find generally are the symptoms of the very basic toxicological properties of those medicines or those drug substances. So if we know that drug substance from even their toxicological dimensions, then the clarity about that drug substance can be increased far more than just to mug up few symptoms given in a certain materia medica. So this is something which is very important. Similarly, as we know, the chemical sources, the accidental sources, the doctrine of signature, the clinical observation, what generally we need to do. And we can then, later on add it to the materia medica understanding. So I would rather summarize the thing in a way that studying materia medica starts from studying the source, the very basic source, its chemical, physical and toxicological properties. The next stage is the very natural behavior or the very natural uses of that particular substance and its interaction with human physiology and psychology. That is very, very mandatory to understand. Like, we all know potassium. We know kali carb is a substance. But potassium and carbon, they both interact in a certain way with a human physiology and psychology. The calcium, calcarea phos, we all know. The whole biochemic is based on the, the interaction of those biochemic salts and the human physiology. But it's not limited to biochemic only. It's with each substance which we are using as a medicine. Our own human physiology and our own psychology relates with it in a certain way. That is also very, very mandatory to understand. So it's interaction with human physiology and psychology is very, very important. So by that time, we have covered 3 stages. Like first we understand the source of it, then we understand the chemical, physical and the toxicological properties of it. We understand its natural behavior, and then we understand its interaction with human physiology and psychology. By that time, that substance would have become familiar for us. Then you start reading the provings and other detailed materia medicas. So whenever you then automatically you will get an idea that okay, now I get an idea that because poison hemlock, the conium poison was already producing this toxicological effect which has already been produced in the Socrates, and now the same I am receiving in the symptoms of materia medica. So you don't have to mug up each symptom, but you will be able to understand much more than that if you have already traveled through these stages of understanding each medicinal substances. So then reading the proving and other detailed materia medica, and then you can later on land upon the various clinically important book like we use Boric or Fatak or the Allen's note or the Murphy's materia medica, whatever you yourself is using in the clinic, and then the repertory. So then the role of repertory comes. So just imagine, to summarize, एक substance जैसे कि just to give you a kind of example like zincum metallicum. So पहले आपने जिंक को समझा, जिंक के प्रॉपर्टीज को समझा, फिर आपने जिंक के यूजेस को, उसके नेचुरल बिहेवियर को समझा, उसके बाद में आपने जिंक का ह्यूमन के साथ इंटरेक्शन, दैट इज द रोल ऑफ जिंक इन द ह्यूमन फिजियोलॉजी, उसको जब आपने समझा, एंड देन उसके बाद आपने जिंकम मेटालिकम का प्रूविंग पढ़ा, केंट्स मटीरिया मेडिका में से पढ़ा, क्लार्क में से पढ़ा, द बेस्ट वन ऑफ द फाइनेस्ट सोर्स बुक हेयरिंग गाइडिंग सिम्टम्स में से पढ़ा, and then almost you will be having a lot of clarity regarding the zincum metallicum so far. And then what you need to do is you just simply need to read the clinical materia medicas and the repertory. I'm sure this will give you a complete 360-degree idea about the zincum metallicum. And now when you are sitting with all these ideas in front of the patient, you will also have a lot of your own observations about zincum metallicum, which will become kind of futuristic symptoms of the zincum for the future generations. So this is all about relating with a drug. Each drug substance, you need to relate with it. You need to connect with it. And the moment you will start connecting, the patient may show any aspect of, like some patient may show a fastidious aspect of arsenic, some patient may show the fearful aspect and anxious aspect of arsenic, some patient may show the suspicious aspect of arsenic, but you won't miss the arsenic if you have studied from all these dimensions and all these angles. So this is a very basic thing which I would like to give you today, so that in the future time, whenever we communicate, we relate, you can understand that what I am trying to give through these digital learning sessions. To summarize, I would just like to give you a message that for the holistic application, the physician needs the holistic understanding of the man or the patient, which is an art and science of case taking, and the holistic understanding of the medicine, which is an art and science of reading and perceiving homeopathic medicines. So for correct to reach towards a simillimum in each case, or nearly towards towards simillimum in each case, what you need to do is you need to develop an art and science of both of these platforms. One is an art and science of case taking, and other is the art and science of reading and understanding the materia medica and our different medicines. Fine. So that's all about today. Hope that it has helped you already, and then I'm sure that in coming sessions we'll still move further with the clarities of wisdom of materia medica, understanding, and at the same time we'll also continue with one by one the medicines and the kingdoms and lot of other things in our coming videos. Thank you very much for your watching the video till the end. It's an educational video, so to make it in a way that it entertains you, or it is very smaller. If it is very smaller, it can't convey you every time everything what is needs to be conveyed. So the videos will be little lengthy. Have a patience of watching it. If you feel that this will help to others as well who want to practice homeopathy, then you can please share them. We'll be more than happy if they'll watch, and you can also ask them that they can subscribe to our channel Homeo Video, or they can join our group in the WhatsApp number whatever you might have joined. So I'm sure it will be helpful to others as well. Keep sharing your problems of studying medicines and materia medica, so that I can guide you more in an appropriate way, the way you want in future videos. Thank you very much. Goodbye.